Council, Lung Center of the Philippines, National Kidney and Transplant Institute, Philippine Children's Medical Center, Philippine Health Insurance Corporation, Philippine Heart Center. I so move, Mr. President.
There being no objection to the motion of the Majority Floor Leader, motion is approved.
Thank you, Mr. President. Mr. President, I move that we recognize the distinguished sponsor of the budget, no other than the distinguished lady from the city of Taguig, Pateros, Senator Pia Cayetano. I so move, Mr. President.
The distinguished senator from the city of Taguig and the town of Pateros, Senator Pia Cayetano, is recognized.
Good afternoon, Mr. President. Good afternoon, colleagues, and to DOH Secretary and the entire DOH family. Mr. President, I am ready to sponsor the budget of the Department of Health, Office of the Secretary, with total new appropriations of 214,851,268,000 pesos. National Nutrition Council with a total new appropriation of 439,167,000 pesos. Philippine National AIDS Council with a total new appropriation of 43,053,000 pesos. Lung Center of the Philippines with a total new appropriation of 1,130,211,000 pesos. National Kidney and Transplant Institute with a total new appropriation of 1,771,442,000 pesos. Philippine Children's Medical Center with total new appropriation of 2,331,078,000 pesos. Philippine Heart Center with total new appropriation of 2,266,827,000 pesos, and Philippine Health Insurance with a total new appropriation of 100,233,414,000 pesos. Am I supposed to read that? Yeah? Okay. Just for the record, but this budget has already been submitted. Philippine Institute of Traditional Alternative Healthcare with a total new appropriation of 156,205,000 pesos. Ano siya? Mr. President, colleagues, DOH has the third highest budget under the leadership of our chairman, Senator Sonny Angara. This Senate, your Senate has envisioned, has aspired to, and has effectively found fiscal space for many of the budgetary needs of DOH, although of course we continue to support them, and if there are and as they continue to be more needs, we want to assure DOH and the Filipino people that the Department of Health has the support of the Philippine Senate. With that, Mr. President, I am ready to accept questions from our colleagues.
Majority Leader.
Thank you, Mr. President. Thank you, Senator Cayetano. First to interpolate is the distinguished Deputy Minority Leader, the distinguished lady from Akbayan, no other than Senator Risa Ontiveros. I move that she be recognized, Mr. President.
We recognize the distinguished Deputy Minority Floor Leader from Panay and the Republic of the Philippines, Senator Risa Ontiveros.
Salamat kaayo, Mr. President. And magandang hapon po, Madam Chair, and to the
Good
DOH
afternoon,
family.
Senator Risa.
Good afternoon, and to the DOH family headed by OIC Secretary Garguere.
Ayan pala si Secretary.
So, Madam Chair, a short manifestation before I proceed with my questions about the budget of the Health Department and agencies. First of all, I want to thank the Senate, the committee, and the chair for their continuous commitment to ensuring funding for the health sector. I noticed that throughout the pandemic so far, the health agencies, the DOH, its attached agencies, and corporations received increases in their budget from 173 billion pesos in 2019 to 274 billion in 2022. And for next year, from the proposed 301 billion to 323 billion pesos. And we should keep it this way, Mr. President, Madam Chair, to realize our collective aspiration for universal health care. And I hope that the health agencies will spend these monies well. I would also like to thank the DOH family, led by OIC Secretary Maria Rosario Vergere, for holding the fort and continuously guiding us as we navigate our way out of the COVID-19 pandemic. Also, I commend them, Mr. President, Madam Chair, for their proactive work in formulating the health sector strategy for 2023 to 2028, reflecting the lessons learned from our COVID-19 health responses to ensure healthier Filipinos. Madam Chair, mukhang even in the absence or before the appointment of a secretary, nakakakuha na tayo ng garantiya at kumpiyansa na may sinusunod na blueprint and roadmap ang ating mga health agencies tungo sa healthy Pinas at healthy buhay ng bawat isang Pilipino. I joined the DOH in their call to all government agencies and instrumentalities with health or health-related funding to align their policies, programs, plans, and funds to the health sector strategy for 2023 to 2028. And with that health sector strategy for 2023 to 2028 in place, at the very least, we can be guaranteed that there is a roadmap toward healthier Filipinos to guide us in ensuring an outcome-based expenditure program for our health. Alam natin, Mr. President, Madam Chair, saan mag-aambag ang bawat pisong ilalaan natin. Di katulad ng 9.2 billion pesos na confidential at intelligence funds ng ilang ahensya ng gobyerno. As an aside, sa pagpasok ng noong 19th Congress, Madam Chair, Mr. President, it is interesting to note na wala pa tayong, hindi tayo makarinig na sinasagawa kung saang sangkot ang DOH, PhilHealth at ibang ahensya nito sa anumang maanumalyang transaksyon, di tulad sa nagdaang mga taon. So at this point, Madam Chair, Mr. President, I'll be asking several short sets of questions about our health agency. Ngayon pa lamang ay humihingi po ako ng inyong pasensya at sa ating mga kasamahan, bagamat iniksian ko na ng konti yung aking listahan. I ask for your indulgence dahil sadya lamang naipon ang aking mga katanungan.
Bago ho kayo mag-umpisa,
Madam Chair.
may I just reiterate what you said? Galing ho sa ating Deputy Minority Floor Leader mismo yung kanyang ikinatutuwa niya na ang ating Senado na pinangungunahan ng ating Chairman, Senator Sani Anggaran, of course with the support of our Senate President, has continually provided for more and more funding for DOH and the health sector, and maski ang ating minority ay natutuwa po doon. So we are off to a good start. Dagdagan nyo pa yung tanong nyo. You put me in a good mood by acknowledging the effort of our Senate leadership, Your Honor.
I'm so glad, Madam Chair, Mr. President. And I do share the sense of the Madam Chair, Mr. President. We're off to a good start, both in terms of affirming yung mga nabuting nagawa na sa mabubuting paraan, and also trying to take this process, yes, to continually improve
Yes, of course.
this process moving forward. Salamat, Madam Chair, Mr. President. So, una po, mga tanong ko tungkol sa COVID-19 pandemic and responses. Madam Chair, during the Senate Committee on Health hearing, I inquired about the status of the COVID-19 National Vaccination Program. During the hearing, I manifested that the DOH should provide us with concrete steps to strive for less COVID-19 vaccine wastage and to accurately and transparently report on these as we urge the public to get boosted. So maaari ko po bang itanong, Madam Chair, ano na ang status ng ating COVID-19 vaccination program? On track po ba tayo? At higit na mahalaga, pwede ba tayong makakuha ng updated figure sa vaccine wastage? Specifically, total vaccine doses received, vaccine wastage rate, vaccine doses wasted, and estimated wastage cost?
How do we respond?
So, Your Honor, I will respond in the order that my brain has processed the request for information. Please feel free to repeat the question if I did not cover it in my response.
Will do, Madam Chair.
So on vaccine inventory, the total number of doses received is 250.38 million. The total number of doses administered is 171.20 million. And the reported wastage is 44 million.
So 44 million, Madam Chair, Mr. President, out of 250.38 million, which would be a little under 20%, if I compute this in my head correctly.
Sorry, ano tong 31?
31 million total wastage.
So hindi 44.
Or accurately 17
Sorry,
point.
Madam, Mr. President,
Yes,
let me
Madam
correct
Chair.
that figure. The total wastage is 31.3 million, and that is 12% of the total, which I will add is within the allowed percentage of wastage. But of course, this does not mean that just because it is in the allowed percentage that DOH is not striving to improve that number, Your Honor. I can also give the reasons for the wastage because some of them, even I was a bit surprised na kasama pala yun sa ano. Would Her Honor like
Yes,
to hear
please,
that?
Madam Chair.
So the reasons for the wastage, of course, one would be expired or beyond the shelf life. I would like to add here because I was very much involved, well, not involved, but in touch and up to date during the last administration. And it will be recalled that some of the vaccines, especially COVAX that we received, I will just look to the agency for to nod, no, if tama yung recollection ko. Since Secretary Vergeire was the face of the COVID reporting all the time, and Yusek Beverly Ho was also very much involved. So many others here. So just kindly nod if tama yung sinasabi ko. One of the reasons for the expiration was because some of the COVAX funded vaccines that we received really had a short lifespan, di ba? So totoong may ganun hong pangyayari. And then there were also those that were subject of natural disaster. There were those that were subject to temperature excursion. And then there were those that were na hindi na pwedeng gamitin, hindi na gamit kasi nga temperature, and then yung discoloration and presence of particulate matters. And then there's such a thing as underdosing and empty vial because di ba by ano yon, by like multiple doses. So they try na sunod-sunod, but there will be instances na hindi nagagamit lahat yon, Your Honor. So all of that contributed to the wastage.
Yes, thank you so much, Madam Chair, Mr. President.
Would you like me to give the reasons? I think that was also part of your what steps they're taking to address this.
Well, actually not. I hadn't asked that yet,
Okay.
Madam Chair, Mr. President. But thank you because of course that would be a natural follow-up question. Nga lang, tinanggal ko na muna yung ganong follow-up question in the interest of
When you
time
want me
to make way for
Okay.
other sets of questions. But thank you for the readiness, and I'm sure the information will be
Show it.
instructive.
It's faster for you.
Sa pagkaalam ko po yung WHO standard wastage rate is 10%. Nabago po ba yon? Since the standard was first set?
Experience from other countries na wastage rates would be up to 30% based on this.
But were there
I read somewhere 10 to 15.
Your Honor is correct. For COVAX, they had initially given a number, a percentage number, which is 10%. But from their experience, was that COVAX experience? Sorry, WHO found that the reality is in low income, middle income, and even high income countries, the wastage rates went up to 30%. So there was then a statement made by WHO that up to 25% is acceptable. I don't think it is meant to be an excuse, but it's just showing the trends and the realities. And the reason why I wanted to put on record the reasons is partly because of the reality that there is vaccine hesitancy. So pag nangyari yun, so one of the steps is to improve, because obviously it would be the job of DOH to procure it. Well, they weren't the one procuring it, but to set the numbers that they need and then intensify the campaign nang magamit nga naman. Kasi kung successful yung campaign nila, edi magagamit, mababakuna. Pag hindi successful, hindi na nga nabakunahan, susceptible pa sa transmission, and then worse, sila din naman ang pupunahin natin na bakit nag-expire. So it's kinda chicken and egg situation, but with the steps that they intend to take, it hopefully will lessen the wastage.
I share the hope of Madam Chair, Mr. President, at salamat din sa pagdagdag sa mga dahilan kung bakit may wastage. These will be costly but important lessons for us moving forward, guidance, how to better manage both our vaccine supplies and continually raise vaccine acceptance among our kababayan, especially that sabi nga, hindi na lang ngayong mga taon kakailanganin itong mga vaccines, pero posibleng taunan na. Even if, and I just one follow-up, Madam Chair, to my earlier question, of the 12% wasted in absolute terms, those were, where did I write that number? Yes, thank you, Minority Leader, 31 million out of the 250 million. So coming in at 12% wastage rate, magkano po yun sa peso value? What was the estimated wastage cost?
MDA lang po yan. Under MDA, kaya lang po, 500
Per unit. Mm-mm.
Yes.
And that's billion?
Yeah.
Billion. We're talking about the wastage.
Yeah. The 12% wastage cost is estimated, and the reason I have to emphasize estimated, because
Yes.
even the DOH does not know the cost, because this was based on these were procured through an NDA, no, non-disclosure agreement. So based on an
that's where
estimate
I
of 500 pesos per dose,
But yes.
it is nangingiti ang ating Deputy Minority Floor Leader kasi baka yun ang next topic. The cost is 15.6 billion.
Thank you, Madam Chair. So just for the record then, kahit itinaas na ng WHO yung standard wastage rate from the original 10% to 25%, kaya pasok doon yung 12% for this year so far. However, baseline data will show that as of August 2022, just 3 months ago, a quarter of a year ago, the wastage rate was at 8.42%. So nakakalungkot lang na sa 3 buwang pagitang iyon, tumaas pa sa 12%, kahit pasok pa rin sa 25% floor, or rather ceiling ng WHO. That wastage rate was equivalent to 20.6 million doses. So as of August 2022, so sayang, nadagdagan pa ng halos 11 milyong doses na nasayang pa 3 months later as of now. And that wastage as of August 2022 was worth 10.33 billion pesos. So muli sayang din, nadagdagan pa ng mga 5.3 billion
Okay.
in estimated wastage
Yes.
cost. So para sa akin po, Madam Chair, Mr. President, ibig sabihin, though we are maintaining the data, tapos syempre humahango tayo doon ng mga leksyon about better vaccine program management. We need to siguro speed up our learning curve. Kasi in just 3 months, ganito pa rin yung naging...
To clarify, Your Honor, may I give a response
Yes,
to that
Madam Chair.
observation? actually po, hindi tumaas ang wastage natin during the period that Her Honor mentioned. What happened was, they did a complete inventory at saka nila natuklasan na nandun sa mga kaduluduluhan na mga warehouse, because 7,000 islands nga naman po tayo, meron pa pala doon. So what happened was, we now have a more accurate inventory. So hindi naman siguro tumaas. In fact, hindi talaga tumaas, but it was probably higher, no, in the beginning. And so now we have more accurate figures, and we can ask DOH to continue to update us henceforth, Your Honor.
All right. Salamat, Madam Chair, Mr. President. I-follow up ko na lang yung ilang pang detalye sa pagbangga ng mga
course. Sure.
numerong ito in writing with the DOH, and just
Thank
request
you.
their response in writing. And lastly, dun po sa mga nag-expire, may napalitan po ba?
Sige, tanda lang.
Ano yun?
Merong bang napalitan sa mga expired
yeah.
vaccines?
And the first replacement.
Yeah.
Apple, one is the one yun.
Yes, 300,000.
And then may pending pa tayo.
Wala pa po tayong request ulit kasi ang dami pa natin.
Pero wala man tayong na-expire pa in addition to the 300 na Covax? Or yun
The
lang?
300,000 was the Covax replacement na dumating sa atin last July.
Okay.
Wala pa kong kasunod.
Oh, but because it's the only Covax na pina-replace natin. Wala pang bagong Covax.
We have requested for more.
More
Pero
yun.
muna lang.
But I mean, yung na-expire, napalitan na nga. Okay.
So, Madam, Mr. President, there are 300,000 doses of COVAX vaccine that were requested to be exchanged, and they have been exchanged, Your Honor.
Okay. And yun kasi yung pangako noon, Madam Chair,
Yes.
Mr. President, di po ba?
That was part of the deal
na
naman.
expire ay mapapalitan. Opo. So all these 300,000 doses
Have
which
been-
expired have been replaced.
Nakarating na. Yes, nandito na.
At nandito na. All right, that is good news, Madam Chair. Maraming salamat, Mr. President. So, just to note, itong napag-usapan nating absolute numbers of vaccine doses wasted and the estimated wastage cost of those vaccines wasted would be equivalent to 4.83% of our health budget going to waste. So, alam naman natin, lalo na ngayon na limitado ang pondo, masikip yung tinatawag nilang fiscal space, umaahon pa rin tayo sa pandemic at sa recession. Every single peso, every single percentage point is precious. Kaya talagang patuloy na babantayan din ng Kongreso at particular natin dito sa Senado in support of DOH's own monitoring of those vaccines in its vaccination program. So,
Your Honor,
yes, Madam Chair.
although what Her Honor said, no, the figures that she said is accurate naman, no, based on the computation, I think a fairer rendition would be yung additional 2% lang. Kasi there will always be some kind of wastage, di ho ba? I mean, let me even expand, no? Like right now, DOH is targeting the immunization of there's a number, no, 137,000 children ba yon who have missed their shots? Tama ba yung naaalala ko? Anyway, assuming my number is, tama, 137,000. So obviously they will have to prepare for that number, right? And if they cannot find all those children, then we will say wastage. But it was still their job to procure. I just want to put that on record kasi tama naman ho yung figures nyo, no mistake there. But to a certain extent, they will have to always be prepared with that and then do the necessary work sana para hindi nga masayang.
Yes, Madam Chair, Mr. President, and as I mentioned earlier, laan naman tayo sa Senado, suportahan ng DOH to learn the lessons no matter or especially if they're painful and costly and support them moving forward in managing these monies and these vaccine or for that matter, any other health supplies better. So, moving on to my next question, Madam Chair, Mr. President, bilang follow-up, no, sa susunod na buwan, magtatapos na naman. Yes,
Mr.
Madam
President,
Chair.
just for the record din, para fair lang din yung ano natin, yung narrative natin, we also have a lot of donated vaccines and some we as recipients, no, wala naman tayong control kung malapit na rin mag-expire yun, but they will also fall under our inventory, di ba? So may ganun din, and of course especially in the early days, we don't say no to donations, but I recall because I also received so many calls from businessmen volunteering to give in our city in Taguig. In fairness to our mayor then, my brother Lino Cayetano, very efficient yung rollout niya ng vaccine. So talagang hindi na namin kailangan, pero ang dami-daming nagdo-donate. So may ganun din tayong kasama sa figures, Your Honor. So they did not order those vaccines naman, but that forms part of the inventory, Your Honor.
That's fair enough, Madam Chair, Mr. President. Then, bahagi din ng vaccination supplies management would be kung may surplus na yung isang syudad or iba pang
Yes.
locality,
Ma-move out.
ma-move out, opo, dun sa mga bahagi sa ating bansa na doon hindi lang hindi masasayang pero magagamit talaga for
Yes.
their purpose.
And Your Honor, not to belabor the point, but to acknowledge the observation and suggestion of Her Honor. Actually, I'm privy to the fact that at the height when the vaccines arrived, IATF Deputy Vince Dizon was meeting daily with the mayors of Metro Manila. Kasi may ganyan talaga ginagawa nila. Like I remember in Taguig City, and pasensya na ho kayo na Taguig City, you are welcome to share Valenzuela City experience, Senator Gatchalian. I just am privy to the experiences of Taguig because lagi ko din kakwentuhan yung brother ko, si Mayor Lino Cayetano at that time. Meron siyang vaccines, hawak na yung vaccines, walang syringe. So, through the efforts, through the friendships and the friendship of Taguig and San Juan, nagpahiram ng syringe. Baka naalala mo, nagpahiram kaagad ng syringe ang San Juan. Maliit lang ang San Juan eh. So, yung population nila compared to Taguig, malaki. So, very willingly, pinahiram yung mga syringe, tapos papalitan. And similar coordinations were done by IATF later on with the other city mayors and provincial governors. So, from the way I've seen it, talagang nag-effort silang ganyan, Your Honor. But your observation is well taken and dapat tuloy-tuloy din kasi nga, yun nga, naiwan sa ibang lugar ang mga vaccines.
Salamat, Madam Chair, Mr. President, also for mentioning that these efforts did and should be conducted in other regions outside Metro Manila. Dahil alam po natin na in the early years or months of the pandemic, meron din pong mga cries for help from local chief executives. Halimbawa sa, if I remember correctly, at one point, was it Cebu and some provinces in Mindanao na kailangan talaga, meron silang pangangailangan pero hindi timely nakakarating sa kanila yung mga vaccine. So,
Nung
all
una
of these
po,
other moving
nung may
pieces
shortage pa
would
tayo.
counter, yes.
Pero later on, lahat naman, lahat na halos nagka-surplus na rin eventually. Sadly, it was really a shortage issue in the beginning. But Your Honor's observations are well taken by DOH.
Thank you, Madam Chair, Mr. President. So, moving to my next question, magtatapos na naman yung declaration of a state of calamity due to COVID-19 extended by the President. At ngayon ay nag-aapuhap na naman ang ating DOH officials on where to get the legal basis for the continuing COVID-19 vaccination program. Madam Chair, ano po yung ating budget allocation para sa COVID-19 vaccination program para sa 2023? Confident po ba tayo na itong mga allocations ay magagamit? At ano po yung panukala din ng DOH given that yung RA 11525 o yung COVID-19 vaccination program ay nakadepende dun sa declaration of the period of the state of calamity. At kung masasabi ng DOH, ano po yung panukala at rekomendasyon nila kay Presidente at sa IATF?
Okay. Mr. President, the Secretary updates me that the CDC, the Center for Disease Control Bill, has passed in the House of Representatives. As I have, as the Senate President and as I've acknowledged, this representation will handle the the hearings and then eventually the defense of the same bill when we finish our budget debates. But what's important about that bill is that it includes provisions that authorize DOH and the CDC then, which we will eventually create, to despite the absence of a declaration of a state of calamity, to do what is necessary, which it would include the purchase of vaccines and whatever else is necessary to address the health needs, Your Honor. So that bill is very important.
Okay, Mr. President, Madam Chair, that sounds like a very innovative and welcome innovative idea. So magpapang-abot naman po ba yung paglapse nung current declaration of state of calamity at masasalo ka agad, madudugtungan ka agad nitong ating magiging CDC, at least in terms of the continuation of the vaccination program?
Okay.
Mr. President.
Well, I am told, Your Honor, because I was not at the LEDAC and I don't know if Her Honor was. No.
I wish I could have been, but
Yeah.
I was not
So,
able to be.
but we are told by the Secretary that during the LEDAC, there was such a commitment. So kaya pala siguro nung when we resumed, our Senate President brought it to our attention that this is a priority bill.
Salamat, Madam Chair. So yung budget allocation po para sa COVID-19 vaccination program for 2023, sa ngayon meron na po ba? Magkano? At saan po natin ilalodge? Dahil state of calamity pa naman hanggang December 31, but we will only start budgeting from that budget January 1. January 1 po ba? Nandyan na po ang CDC, but di rin naman natin pwedeng budgetan sa ngayon dahil hindi pa siya nag-e-exist.
Sobra po po sa pera. So 5 million doses, 3.4 billion
5 million doses?
for bivalent vaccines.
Sorry, 5 million to? Okay.
We're planning to buy yan muna po. Because
Ito muna. O, parang ganun mo. So, first of all, meron pa tayo. Plus, di ba? May existing
Yes,
pa tayo.
yung hindi bivalent, the ordinary vaccine. So yung bivalent, ito po yung inaaral natin. And then,
And this is a loan.
yes, this is part of the savings of previous.
So, naka-ano na yan? Naka... Okay. Oh, okay, okay.
And then, the products will be educated also in this space.
Okay. So, Mr. President, we still obviously we still have no inventory, but then proceeds of the loan worth 3.4 billion will be available to purchase 5 million doses of the bivalent vaccines already, Your Honor. And then COVAX has also committed for 2023 that they could give out bivalent vaccines also, Your Honor. And then
So 20.
Okay. there are also proceeds of loans that are available from ADB and World Bank for 2023. So they're pretty much set, Your Honor, as the case, as the need arises.
Thank you, Madam Chair, Mr. President. Pati po yung unang binanggit ni Madam Chair na 3.4B for 5 million doses, loan po iyon. Tama po ba?
Loan, but it's
Okay.
already, the funding is already there.
It's already there. So confident naman po tayo na kahit walang budget allocation for COVID-19 Vax program for 2023 in the GAA, dahil hindi na natin inaasahang may declaration of state of calamity pa at hindi pa natin realistically maasahan na by January 1 nakatayo na yung CDC, DOH is confident
They are
na
confident, Your Honor, yes.
dito sa
That they have sufficient funding
Okay.
for the purchase of COVID vaccines, including the new bivalent kind of vaccine, Your Honor.
From COVAX as
Yes.
well as other sources.
And I need to emphasize, because I was familiar with this information, that during the last 2 years or so, precisely why then Secretary Dominguez wanted to fund vaccines through loans was because the interest rates were very low, no? Is that correct? Yeah, so the Secretary is nodding. Yun kasi yung recollection ko eh. These are very good terms. So I remember when I was defending this very same budget, of course the concern was people need to see that we funded it, no? But talaga hong maganda yung terms ng loan na ito. So kaya yan, and we are now able to use the proceeds of that loan.
And yung mapoprocure pong doses from the loans plus from COVAX, sasapat na po hanggang December 31, 2023.
There are many loans that they can get funds from. So unless there is some major outbreak or something, let me double check. Correct, yeah.
So this one is up to more or less in this 5 million and just price to cover caregivers and
Nakikinig mo sila naman. Okay. So, Your Honor, the game plan is to purchase by tranches because, again, they're very mindful of wastage. So, they need to also see what is the uptake of the vaccine. So, itong 5 billion nila will cover health workers and senior citizens and maybe some immunocompromised people. And then from there, they will see. Kasi, and this is just the personal opinion of this representation. When people feel confident about it, di sila masyado excited magpa-vaccine, di ba? So, ganun yon. But, so probably nga, yung tatlong sector na binanggit natin, yan yung medyo masigasig na magpapabakuna.
Yes, Madam Chair, Mr. President. So just as a quick aside, so mag-ano pa rin, parang sectoral pa rin na prioritization, hindi yung tulad nitong patapos na ng year 2 of the, or year 3 of the pandemic, halos iniengganyo na lahat kung sino ang pwedeng magpabakuna na at kung sino ang pwedeng magpa-booster na. Kasi binanggit po yung health workers, seniors, immunocompromised, ganun pa rin yung magiging mode
No, to
natin.
be clear, Your Honor, in terms of the budget, no, that number was a response to the budgetary question.
Yes.
Parang ilan ang mako-cover noon. They are quite confident that those are the sectors that would be interested in availing and evidence-based, sila naman ang talagang unang tatamaan. As to the general plan, again, it will be evidence-based. So if there's a new variant that appears to affect the entire population, but based on the trends in the past, ganun pa rin, di ba? The immunocompromised. So ganun naman ho ang rollout talaga nun. So evidence-based, they will update us and secure the vaccines as necessary.
Yes, I agree, Madam Chair. Yun yung isang siguro pinaka-precious lesson natin about our pandemic response na kailangan talaga evidence-based and halos naging common knowledge na lang yung usapin ng herd immunity, 70%, 80% of the population. So, but just to ask this question one last time, yung confidence ng DOH na using the loans plus the COVAX donations, there will be enough vaccines in 2023 kahit sa general population po. I mean, after the priority sectors or groups.
So we have
Yes, because of the availability of vaccines from COVAX and then the loan proceeds that I had mentioned, they're quite confident, Your Honor.
Okay, good to know, Madam Chair, Mr. President. And last follow-up on this. So the assumption is that 2023 vaccines will still be boosters, not primary series vax program. At hindi pa ba tayo mag-expand sa below 5?
Boosters pa rin, Your Honor.
Boosters pa rin po.
Mm-mm.
Alright. At yung below 5, hindi pa po sila sakop dito sa inaasahan sa loans at sa COVAX?
Natin. Or also worldwide ba yan?
sa ibang bansa.
Ba't tayo
Okay. Our experts are still reviewing for the 5 and below, Your Honor.
Thank you, Madam Chair, Mr. President. Pero sana within 2023, alam natin pareho, Madam Chair, maraming magulang ng mga below 5 nag-iintay din ng advice mula
Kasi
sa
I also
experts
asked,
at
Your Honor,
experts.
even abroad, parang konti pa lang daw yung studies. Kaya since medyo we also rely on that, no, wala pa talagang clear direction for 5 and below.
Alright. Salamat, Madam Chair, Mr. President. Moving to my next question. Up to this moment, Madam Chair, Mr. President, my office has heard reports and complaints about the implementation of the anti-hospital deposit law Briefly, pwede po bang mabigyan tayo ng Health Facilities Oversight Board o yung Sumbungan Board ng update sa mga accomplishments nila? Ibig sabihin yung mga reklamong natanggap, naimbestigahan, mga kaso na nahain at na-resolve, tsaka gaano pong kabilis o katagal ang resolution ng cases na inilalagak sa board.
67 pending cases lang po.
Tapos, pinapakinggan niyo yan. Ano?
Opo,
Paano?
ma'am.
How many resolved? 103 and 36 are resolved.
Yes, ma'am. All over the Philippines po.
Ano
ma'am.
napakinggan? Ibig sabihin, walang katuturan niya.
Hindi nagtutuloy yung mga applicants. One affidavit.
Talaga?
Yes, kasi it's a criminal case to be sent to the prosecution din. So, yung mga complaint, hindi na rin yung
Ano kaya, no?
Okay, Your Honor, they have received 103 complaints. 36 have been resolved. But I won't stop there, Your Honor, because I'm sure we share the same concern. The reason that they've been resolved is basically the case has been dismissed, pero parang for failure to prosecute. Wala daw silang, that's my term, I'm using it lightly, which I shouldn't really as a lawyer. But basically, hindi na tinuloy yung complaint. So, nahirapan daw sila to get the affidavits and also I feel bad about that because it doesn't mean that the case was resolved. It just means that the case was not pursued, no? So, maybe we can come up with, because at the end of the day, unless that was a fabricated case, that means nagsuffer yung complainant, di ba? Hindi lang niya tinuloy yung kanyang pag-resolve. So, but I will be the one to ask this additional question, Your Honor.
Salamat, Madam Chair.
Do the hospitals deny that it happened?
Hindi naman, ma'am. Yung kung may position naman yung hospital, ma'am. So they have their own position. Yung complainant, ma'am, lahat na po ginawa namin. Mag-LBC kami, tumawag, mag-email, and
Okay.
then they do not
So, you mean hindi naman dininay na?
Hindi
So,
naman. May
umamin.
mga answer naman sila, ma'am. Hindi naman sila.
So, participative naman daw yung mga hospitals. Ang
Mm.
problema, hindi naman nila ma-pursue kasi hindi na nila ma-follow up yung ano. Pero I think, Your Honor, if I may just give DOH this feedback, I think if I can speak for our colleagues as well, siguro yung objective, gusto natin mangyari na DOH on their own. So if there's something wrong with the law, like if DOH in its administrative capacity, di ba, should have can make administrative sanctions if there seems to be valid cause for the complaint kahit nawala na yung complainant kasi the fact remains that the hospital violated. Binabanggit po sa akin na being a criminal case, hindi nga naman ma-pursue. Di kahit hindi na criminal way, di ba, Your Honor?
Actually, Madam Chair, at salamat po para dyan, Mr. President, mandated po ang DOH ng Anti-Hospital Deposit Law through the Sumbungan Board to in fact be as proactive as possible in partnership with or in support of the aggrieved patient or his or her family kung namatay yung pasyente. Meron pa nga dong, if I remember correctly, mga provision at dapat nakapaloob sa IRR tungkol sa assistance sa pasyente o pamilya in terms of legal assistance, preparation of the necessary complaints or cases. At ang maganda sanang bunga niyan, Madam Chair, kung hindi lang 36 out of 103 complaints ay umusad, that's less than 1/3, pero hindi resolved, no? Sabi nga ni Madam Chair, dismissed, failure to prosecute, kahirapang i-execute yung mga affidavits. Ang isa pang kagandahan, Madam Chair, kung sana maging mas mabunga yung track record ng Sumbungan Board, bukod sa matulungan, mabigyan ng hustisya yung pasyente o yung pamilya nila, learning experience din for the hospitals.
Of course.
Opo.
Your Honor, to be clear, upon further inquiry with DOH, ang hindi lang naman natuloy is the criminal case. Pero ang pinapaliwanag sa akin is that the administrative case proceeds. Because nga, as you said, may power naman sila. And yun din yung napansin ko. So sabi ko, liwanagin lang din yan. Kasi importante din yun sa publiko di ba?
Yes.
Na malaman naman nila na the DOH is being proactive, Your Honor.
Yes, Madam Chair, Mr. President. And kung alam natin yung volume at yung emotion ng mga reklamong ganito kahit pag naghihinga ng kalooban kahit online lang sa social media, talagang on the one hand, ang lalim at ang lakas nung sakit ng loob. At the same time, may appreciation if action is taken and if positive action is taken. So hopefully moving forward, itong Sumbungan Board can be even more fruitful with any patients and patients' families na lumapit sa kanila. And just as a follow-up to this, Madam Chair, since the law is 5 years old already, may assessment na po ba ang DOH sa effectiveness ng said mechanism na ito para tugunan yung mga kaso? At pwede bang malaman kung yung trabaho mismo ng board, no, yung Health Facilities Oversight Board ay funded at supported? Magkano po yung inalot natin para dito?
Mr. President, DOH regrets that during the pandemic, the board was also not able to convene as much as it had wanted to. But in the past months, no, I would say the bulk of this year, the intention really is to make up for the lost time. So instead of having 5 years of the law behind it, parang 2.5 years lang daw sila halos nakagalaw.
Opo, Madam Chair, dahil ipinasa po yung batas na iyan 2017, so just barely 3 years, or so to
2.5
account possibly for
siguro,
the 2.5 bago po tumama yung pandemya. Of course, alam po natin na nung kasagsagan ng pandemya, yung pagpunta ng ating mga kababayan sa mga emergency room ng mga ospital, in fact, ay tumaas. So sayang, hindi nakapag-convene ang Sumbungan Board even those years where maybe mas marami sanang pasyente ay dumulog sa kanila. Gayon pa man, mabuti kung balak ng DOH na i-activate ito ulit.
Activated naman po.
Yes. Ibig sabihin, kahit patapos pa lang tayo sa pandemic, no, kumbaga maging bukas sa paglapit ulit ng mga pasyente. May inalat po ba tayo para sa Sumbungan Board ngayong taon, Madam Chair? Sa susunod na taon, rather.
Pero konting-konti.
HF.
HFSRB budget. Pero kung madadagdagan po that please expenditure.
Anong title mo?
Health facilities, health
Ikaw ba yan?
Yes,
Oh.
health regulation team budget.
Hindi, ikaw.
Asset for health regulation.
Yung ASEC for Health Regulation,
Anong person mo?
Shireen.
charade, na-excite sa tanong nyo. That will be very welcome daw po. Madagdagan, meron naman daw po silang budget, meron.
Magkano
Pero
po, Madam Chair?
madadagdagan, that would be very good daw po.
Magkano po ang current ina-allot para sa board, Madam Chair?
90 million, ma'am.
Mr.
For
President.
HFSRB.
And ang
We have an
nakuha
appeal.
nyo?
We only have 50. Kulang.
They have 50B, Your Honor, pero ang request, 50 M, sorry. 50 million, Your Honor, pero ang request nila is,
Sana po mabigyan kami ng 90 million additional, ma'am.
additional pa nun. O medyo lumakas na yung loob, medyo malaki. Ano daw,
Kasi ma'am, kasama
akal-
po yung region yun, ma'am.
akala ko yung sabi niya is kahit hanggang 90 M. Yung pala plus additional 90 M. Kasama daw ang regions.
Well noted, Madam Chair. At salamat sa pagbanggit ng Sumbungan Board na o nga, sa mga rehiyon, ine-expect din silang mag-operate, hindi lang dito sa Metro Manila. Okay lang po yung malakas ang loob, Madam Chair, na Sumbungan Board.
Naman.
Doon din pwedeng lumakas ang loob ng mga pasyente at pamilya nila sa kabila ng hirap na dinanas nila or trahedyang sinapit nila, na malaman na merong working mechanism na pwede nilang lapitan. Yung pong 36 out of 103 cases na na-resolve or umusad, mga 35% case resolution po iyan or opo. So may target po ba ang board in terms of performance, in terms of percentage?
With the help of our secretariat, ma'am, we want po sana at least 10 resolutions to be resolved per meeting, ma'am. So we
Tuwing
have
kailan ba meeting? Once a month?
once a month meeting, ma'am.
Okay, Your Honor, ang goal nila with the help of the Secretariat is 10 resolutions per meeting and they meet once a month.
Alright.
Eh di yung naiwan, sana in 6 months tapos na.
Yes, Madam Chair.
First in, first out naman para
Mm.
naman yung mga nag-aantay hindi na humaba pa.
Yes, Madam Chair, Mr. President. Salamat po para doon. And lastly, yung mga na-resolve so far, 36 out of 103, gaano po kabilis o katagal yung resolution na iyon?
O yun yung inabot ng pandemic?
Ma'am, in 2018, we have 31 cases.
Ah.
In 2019, we have 43.
Ah.
And in 2020, we have 21. Although nag-stop na po kasi nung March. And then nung 2021, 8 lang po talaga, ma'am.
Oh, so ngayon?
So, sa
Okay.
ngayon, ma'am, ongoing pa rin yung iba, ma'am, kasi we need to reconvene kasi yung iba wala na rin, ma'am, yung ibang members. But
Pero
continue,
kulang ba kayo ng member?
nag-reconstitute na kami.
Okay, okay.
Sige, Your Honor, in the first year, 2018, they had 31 cases resolved. The following year, 2019, they had 43. And then in 2020, inabot na sila ng pandemic, but they were able to resolve 21. Now, they have just reconstituted the board. So they will, hopefully, sana within the year, maano pa yan?
Madagdagan namin.
Madadagdagan naman daw.
So, salamat Madam Chair, Mr. President. And obviously, hindi tumagal ng isang taon yung resolution ng bawat kaso dahil tens of cases they were able to address per year. So, umaabot po ba ng ilang buwan or ilang linggo yung pag-handle sa bawat case on average?
On average, ma'am, may umaabot po ng ng buwan, ma'am, talaga. Kasi our
Magkama.
regional licensing pa, will have to go to different, iba-iba kasi, ma'am, yung mga areas ng mga hospitals nasa Luzon, Visayas, Mindanao.
So yung
Kailangan-
regional niya umiikot
Yes,
pa?
umiikot to also get the affidavit,
Ah.
interview.
Kasi, Your Honor, aside from just the complaint being filed, the regional representative has to get the affidavits, do the interview. So it's a little bit cumbersome as it appears even to me listening, Your Honor, na kailangan puntahan. And then yun nga, kaya sadly yung iba, hindi na nga nahanap, hindi na nakapagbigay ng affidavit.
Iba-ibang
Pero wala po ba silang, Mr. President, Madam Chair, na average length of time na tinagal ng pag-handle ng bawat kaso? On average,
5 years
isang buwan ba, isang linggo, ilang buwan?
to as presented, ma'am, we were able to resolve at least mga nasa 30 cases.
Parang hindi maganda yun.
Pero
Well, let's just put it this way, Your Honor, no? Because nga of the pandemic, so wala tayong 2.5 years na magandang data. Then the first 2 years, they were
Yes.
just starting. So let's just be proactive about it, na they really want to be able to solve the cases faster, more efficiently, and with regularity. Kasi regular na mag-meet yung within 6 months sana nasa
Within
solve.
6 months. Sige po, Madam Chair, Mr. President, I'll take that. And I'll take it to mean na on average, posibleng umaabot ng more than 6 months. Kaya ang target nila ngayon ay within 6 months, better na ma-resolve yung kaso na darating pa sa
may
kanila.
umaabot din ng ganon. Oo.
Alright.
But I guess just to put some good just to put better feedback on the floor, Your Honor. Meron din sigurong mabilis lang kung talagang nakukuha ang mga affidavit, tama ba? So kung nakukuha naman din ang mga affidavit, napapabilis naman po. Anyway,
I'm
if
sure,
Your
Madam
Honor doesn't
Chair.
mind, I would be more than happy to work with them from the legal perspective. Kasi meron din yan yung mga affidavit na parang fill in the blank. Alam mo yun? Parang
we have that draw.
meron naman daw. Okay.
Basic assistance.
Thank you, Madam Chair. And
Okay.
akin to what Madam Chair was saying, Mr. President, it would be of public interest and importance kung magagawan po ng DOH ng public information campaign itong anti-hospital deposit law at mabibigyan kaalaman ang publiko paano gumagana yung sumbungan board. So to initiate the process better, faster. At higit
And-
sa lahat, yes, Madam Chair.
Sige
Well,
po.
higit sa lahat, paano natin mapapataas ang kumpiyansa ng ating mga kababayan na matutugunan ng sumbungan board ang kanilang reklamo at may kaukulang kaso na maisasampa at parusang mapapataw.
So,
Ang idadagdag ko siguro, Mr. President Jan, is yung kung ano yung mga lessons na natutunan ng board dun sa mga kaso nila, ma-share na agad nila yan sa mga ospital para hindi na humantong sa pagrereklamo. Kung ang batting average nila is magiging 5/5, dahil 5 na lang yung nagreklamo, di lahat tayo masaya, di ba? Kasi konti na lang yung nagreklamo dahil wala nang violation.
Yes, Madam Chair. Mr. President, salamat po. Dako na po ako sa susunod kong tanong. Ito po yung mga tanong mula sa mga partner organizations na katrabaho ng opisina ko on several of our health advocacies. So una po, Mr. President, Madam Chair, has something to do with the One COVID Allowance or the OCA na may magandang balita recently at marami pa rin pong, kaya lang marami pa rin pong nagrereklamo na hindi pa nila natatanggap ang kanilang allowance. Now, based on the report, may 526,727 eligible health and non-healthcare workers. Lahat po ba ito ay nabayaran na? At ano po yung status ng pagbabayad natin?
Ito yung na-disperse, 29 billion. Ang nabayaran na po natin na healthcare workers na nabigyan na natin from January until this time is 1.4 million
Okay.
with 10.4 billion money. There's another one that we have paid already in the past. Kasi SRA pa po nung before, binago lang yung policy na
yes.
nag-KIA. So ito pong around 72,000 plus healthcare workers receive this amount of money of around 1.1 billion.
Received 1.1.
Yes, opo. Tapos, meron din yung dati yung meals, accommodation, and transportation. Pero hanggang ano lang po yun, September to December of 2020, we were able to release 1.4 billion to them.
Ilan sila?
414.
So, ano yung sinasabi niyang 526 daw? It's may latest news na ganyan. Ano yan?
Wala ho kaming,
Ano yan?
yung 526 na thousand na healthcare workers.
Hindi mo yung 805,860.
805,000.
This is our database, the complete list.
Ay, exactly.
805. Hindi, dati na yung 520 plus.
So, yung this is the expanded definition.
Yes.
diba?
po.
Oh, and then,
As she's saying na kung yung 520 plus receive their monies already.
Yeah.
Ito na yung binibigyan namin ngayon,
But-
805.
they are currently receiving or in the process of disbursement.
In the
This all
process.
has been released.
No,
Okay.
in the process, kasi it depends also if they have completed their requirements.
805. Okay, so basically the announcements 825 are now being processed and some have received, some are being processed.
Yes, opo. But only up to what month? Only up to June of 2022 na hiya ang na-release.
So do I say January to June?
Yes, January to June 2020.
Ito pinili na ng funding. Jan, ito nga, 500, ito yan, di ba yung 800? Ayan, 805. 805, but ang nirelease nyo pa lang is
January to June.
January to June,
June pa lang ang binibigay ng DBM.
which is equivalent to
equivalent to yung January to June. How much were we able to release?
11 billion.
11 billion.
Okay. Yung 805 is the new law, di ba? The new law that,
Mr. President, just to clarify, because the figures have changed, the 526,000 health workers that Her Honor mentioned has been expanded to 805,863 to be exact, of beneficiaries. So the base is now 805,000 beneficiaries, which is based on the law that also covered defined other eligible health workers. So with that new figure, they are all now being processed, and the amount of 11 billion pesos has been set aside, has been released by DBM for processing. So obviously it depends on if the records are complete, then some people would have been processed, others are still pending. But that is already secured, and this will cover the period from January to June 2022.
Salamat, Mr. President, Madam Chair. So ito pong 805,000 plus ay pinoproseso na yung kanilang ibabayad sa kanila in the magnitude of 11 billion pesos. Ito po ba ay yung ibinalita sa dyaryo na matatanggap na nila before Christmas Day?
Kung mag-release ang DBM,
Akala ko na-release na. Sorry, mali ba
ito
yung
yung
sinabi ko?
initial na 11 billion ni-release
Okay.
nila. But we still need 27 billion
Okay.
para po mabigyan yung
Itong lahat.
Opo.
Or just, but January to June pa rin yun.
no, that's for
For the entire
July
year na.
to end of December already.
Okay.
19 ang na-release. But hindi, yung from July to December is 27 billion.
100.
No. From July to December, walang arrears. Yung July, 35 billion, not 27. 35 billion, Senate.
Ang kailangan.
Opo, hanggang December, July to December.
Oh, pero yung January to June, may 11B na kayo. Tama ba yun? Kasi 19 na pala.
From the start of the year.
Okay. Tapos covered na yan. And then 35 ito.
Yes.
Bakit mas malaki ito?
Bakit mas malaki yung 35 na July to December?
Kasi
Kasi,
may expanded pa.
kasi na-expand.
Dito lang na-cover? Dito lang ba na-cover?
Yan natin.
What's yan?
The health emergency
Ah,
allowance.
Okay.
The transition.
Okay. Mr. President, just to be clear, the January to June figures that have been made available by DBM is not 11 billion, but 19 billion.
19.
Okay, now, for July to December, what is needed is 35 billion. So if that amount will be released, then they are up to date with what is required to be paid our health workers and non-health workers under the law. I want to clarify, Your Honor, that the expanded definition now includes non-healthcare workers who are otherwise exposed. Because I remember that was in our law now when we discussed this. Thank you.
Yes, Mr. President, and thank you, Madam Chair. So yung 19B para dun sa 805,863 persons covering yung accountability natin sa kanila for January to June 2022. Yun po yung pinoproseso na ngayon at
Yes.
ito po yung nasa dyaryo yung matatanggap nila before Christmas Day. Okay po. And then, yung pong kulang pa, wala pa po tayo nung 35 billion pesos, yun po yung dapat mag-cover ng July to December 2022 for the same 805,863
Tama?
people.
Yes, Your Honor.
Thank you, Mr. President. So, at any rate, kung may ganito po tayong arrears o utang pa, magagaransya po ba natin na yung mga claimants ay mababayaran? At may timeline ba kung hanggang kailan sila maghihintay na babayaran nito?
Well, Your Honor, we have programmed and unprogrammed funds that this Congress, tayo po yan, with the leadership of our chairman of the Committee on Finance, put in since when we deliberated on the 2022 budget. So meron yan, part of it would be covered by programmed and part of it would be covered by unprogrammed. So as far as DOH is concerned, I suppose they're also expecting kasi kasama yan sa mga wish list nila, Your Honor.
Yes, Mr. President, Madam Chair. Sa programmed funds, saang mga programmed fund pwede natin kunin either yung buong or yung bahagi ng 35B?
Actually, for 2022, 9 pa nalabas siya? 9 billion? So wala na yan. So unprogrammed na lang. So tapos na. Okay. Mr. President, the 2022 GAA reflect 9 billion for program funds and 42 billion for unprogrammed funds. So definitely may pagpupuhan.
At yung, Mr. President, yung 9B na programmed funds ngayong 2022, intact pa po yun. Mamomobilize po talaga para sa bahagi ng 35B.
Yung 9B na yan, di ba?
Na-release na yung 9. Meron na daw.
Anong meron? Kompleto?
Mas,
Okay.
ma'am, yan yung total requirement.
Yung requirements to, tinatanong.
Hindi, yung 9B lang naman. Yung 9B na nasa 2022 GAA.
19 billion ang na-release na. Ito na po. 19 billion na po.
Wait, how do I reconcile 19 with 9?
This po kasi is 19 billion yung program plus 42 billion program.
29 nga. Ay, ang na-release 19.
Pero meron po kasing 42 din na unprogram. So may na-release pa rin po from unprogram.
Ah, ganun lang yun. Okay,
Yes.
okay. So 19 na yung, so yung sinasabi natin kaninang 18, yun ba yun? 19?
19 po. Yung na-release na. So we still need 35 till the end of the year.
So yung sinasabi ko kaninang 18, it's 19 pala. Tama ba?
19.
Do I make that
Yes
correction?
po. 19 is the total released by DBM.
The updated amount, Your Honor, I went from 11 to 18. It's now 19 that has been released, no? Kasi moving, ano naman yan, moving target. And part of it has been sourced from the program funds, the 9B, and the others were already coming out of the unprogrammed, Your Honor.
I see. So wala pa po tayong mapagkukunan dun sa 35B na kailangan para sa July to December 2020.
Mag-aantay tayo sa
Mr.
DBM.
President. Nakapag-make representation na po ba ang DOH sa
Yes.
DBM?
Oo, lagi. Mula pa nung hearing, they updated us that they have been making, I just like our health workers and non-health workers covered by this law to know that walang tigil na nagpa-follow up ang DOH, making representation straight with DBM, with your Senate, and as far as I know, diretso din sa Malacanang.
Salamat, Mr. President. So, napag-usapan na natin ni Madam Chair yung tungkol sa 19B para sa January to June at i-release bago araw ng Pasko. Isang magandang regalo o mula sa DOH sa ating mga health and non-healthcare workers. Napag-usapan po natin yung 35B na nagme-make representation pa ang DOH para sa July to December 2022. Lastly po para sa 2023, magkano po yung public health emergency benefits at allowances para din sa health and non-healthcare workers?
Di ba yun yung ginawa ni?
Yes, for
Yung maikte, yung madali.
Yes, here po.
76 billion.
77 is what I have na. Baka up to date na to. 77 na to eh. Oo.
76 billion.
Oh, yun. Sige. So the latest figure I have, Your Honor, is the funding. Well, there are two scenarios, Your Honor. If there will be a public emergency and if there will be none, no? So if there is no public emergency declared or if it is not extended, then the funding requirement is 64.65 billion and we have allocated 77.9 billion. So may balance pa ho yan ng 13.27 billion. But if there is, ano ba to? Tama ba? Sorry, this is arrears lang.
This one,
Or this already includes arrears. This amount, 64.
Ayos lang po. This one, ayos lang.
Arrears for 2022.
Yes. 2021.
For 2021 yung arrears, Senator.
2021 yung arrears kasi current to eh, di ba? Yeah. Your Honor, to be clear, the figure I gave includes the 2021 arrears.
Salamat, Mr. President, Madam Chair. So,
To be clear, Your Honor, kasi maybe the word include is not correct. It represents the arrears. Kasi wala na eh. Wala nang state of emergency, di ba? So wala nang bago. Wala nang kailangan pondohan. Arrears na lang yon.
so yun po yung Mr. President, pangalawang senaryo na wala nang idideklarang
Hindi, yun yung first scenario na walang public emergency.
Wala.
64.65 billion
Right.
ang kailangan because may utang na tayo.
2021. Pero
And-
may allocation na 77B. So higit pa.
Yes.
Higit
But
sa
if
sapat.
there is a public health emergency, then extension for 2023, then the total amount needed would be 141.2 billion.
At sa senaryo pong iyon, Mr. President, may projections na po ba kung saan ang funding source natin para dito sa 141 billion pesos plus para sa public health emergency benefits and allowances?
As of now po, kulang tayo.
Kulang pa. Eto, Madam Chair, Mr. President, an idea dun sa, hindi lang yung representation ng DOH sa DBM at iba pa, tungkol sa July to December 2022 obligations, but moving forward to 2023. I have data na DOH has unobligated amounts of 113.9 billion pesos, at least as of October 2022, last month. Kasama po dito sa 113.9 billion unobligated ang 40.273 billion pesos para sa COVID-19, pero hindi gagastusin ngayong taong 2022. So, pwede po ba itong gamitin para i-cover yung OCA, unang-una na, sa July to December 2022?
That's from the loan.
So hindi pwede.
Oh,
Yung 40 na yan. That's from the loan.
we are trying to restructure it now.
Kung pwede.
Okay.
So but
But,
that is subject to the restructuring.
Yes, and it's not intended for the healthcare workers benefits because there are other things.
So
for
if you
this.
restructure it,
It's for
for
our infrastructure and.
pwede. Is the correct term?
Pwede. Hindi
What's the correct term?
Ilagay sa healthcare workers yung
Funds not yet for
specific deliverable kasi sa World
it's
Bank
related to COVID.
So World Bank doesn't
include that one. Yung allowances for the part.
Okay. Your Honor, the 40 billion that Her Honor mentioned is proceeds of the loan with World Bank, tama ba? With World Bank. So it's the use of which is very specific. So they are currently trying to restructure this, but their menu of allowable activities or products, sorry for the right term, but their menu there would not include health workers kasi menu ho yan ng World Bank. It's not within our control, Your Honor.
I see. That's too bad, Mr. President, Madam Chair. Pero sige, kung ibukod po natin yung 40.273B na may World Bank loan menu, hindi pasok doon yung OCA, out of the total unobligated amount of 113.9B, ibig sabihin mayroong pang 73.7B. Yun pong 73B, pwede po ba natin gamitin para i-cover yung OCA? Yes, yung OCA. July to December 2022 muna.
Ongoing kasi yung procurement. Yes, no, it's part of MAIT, it's part of the health facilities.
Okay. Unfortunately, Your Honor, of the currently still unobligated amounts, they have ongoing procurement. Is that the right term? They have ongoing procurements, Your Honor. So, hindi nila to pwedeng basta itigil yung nasa proseso na para dalhin dun sa ating gusto sanang mapondohan.
Of course, I understand, Mr. President, Madam Chair. Procurement ng vaccines or ng iba pang supplies?
Iba-iba po.
Iba-iba.
Iba-iba, hindi na vaccines.
Hindi na pong vaccines. Okay po. Well, it was worth a try.
Of course, of course.
Yes. Ito pa, isa pang pahabol, Mr. President. I have another piece of data na out of the 19.4 billion released to DOH, so I'm presuming this is yung para sa OCA ng January to June 2022, may 6.02 billion pang unobligated. Bakit? Or is this in the process of being obligated para i-cover yung January to June 2022 OCA?
Paano ko ba 9 and 11 yun? Malamang kasi yun yung report nila. Including yung mga
Pero nasa region.
Yes.
All the monies have been brought down to the region. Kasi mapili facilities sa pera. So baka.
Through the facilities kasi.
Opo.
Okay.
Kaya baka
Okay.
nakita complicated siya kasi hindi pa na-perfect.
Okay, Your Honor, as we speak, the funds have been downloaded to the region. So that's good news. Umaandar siya. Sana meron tayong digital mapping para kasi I'm sure Your Honor will be reporting, 'di ba, to our very hardworking health workers and non-health workers. Sana kung may way tayo mapakita din yun bawas din yun sa natin sa dagdag na trabaho that we have to do explaining. So nandun na sa regional, and then they have to enter in MOAs with the different facilities to ensure na, di ba, tama naman kasi malalaking pera din yan, bulk yan na tinatanggap ng mga facility eh.
Salamat, Mr. President, Madam Chair. Yes, as Madam Chair said, I will relay this update to our partner health and non-healthcare workers almost real time dahil habang ini-interpolate po natin dito. So, I just hope that with regards to this subject, the DOH keeps its door open to dialogue with labor
Of
groups
course,
to
oo.
find a common agreement on how and when the claimants are paid. Lalo't karamihan sa mga lumapit sa amin ay nagsasabing ang kanilang mga health facilities, so siguro pati dito sa mga rehiyon na na-downloadan na, ay nakapag-comply na raw sa mga requirements na hinihingi ng department. So salamat po para doon, Mr. President, Madam Chair. Dako naman po sa reproductive health services. So, one of our partners in reproductive health advocacies reached out to my office on two concerns. And I was actually able to talk with a good chair about one of them. The first was an inquiry on the availability of sexual and reproductive health services. For example, family planning consultations, services, and supplies for migrant women throughout their migration process and the duration of their employment abroad. At pangalawa, di umano pansamantalang naputol ang serbisyo, halimbawa ng Likhaan Center for Women's Health sa pagbibigay ng libreng injectables, pills, family planning pills at implants sa kanilang mga kliyente dahil di umano sa kawalan ng libreng supply na nagmumula sa DOH at POPCOM. So in addition to the kind earlier reassurance of the chair to this representation, maaari po bang makakuha ng tugon sa mga concerns na ito at kaya ba ng DOH maggarantya ng uninterrupted family planning services and supplies? Oo.
Yes, I confirm no that Her Honor the Deputy Minority Floor Leader and I had a exchange on this, and through our collective efforts, I'm happy to announce to our colleagues that we immediately coordinated with the DOH to ensure the continuous supplies with the civil society partners, Your Honor, kasi we know from experience that they've really been the hardworking force behind the effectivity of reaching the women who need this. So we are one with the Deputy Minority Floor Leader, as DOH is, no, to ensuring a steady supply. So that's for 2022, at least, no, because the concern that Her Honor raised was very specific na kinapos sila ng supplies. But moving forward, Your Honor, you mentioned migrant workers as well.
As well, Madam Chair.
And I was just briefly discussing, as Her Honor was explaining, that ang injectables have a 5-year what do I call it, lifespan?
Shelf life.
Effectivity.
Effectivity.
So the DOH works again with our partners to provide this service. So baka siguro pwede natin dagdagan yung information campaign, not just with the partners but DOH, na if ikaw ay migrant worker at gusto mong siguraduhin na meron ka pa ring access, they can consult, and if this is the mode of contraceptive that works for them, then 5 years po yun.
Opo.
And the other thing I wanted to add, and this is just from my experience working with the Interparliamentary Union, yun nga hong Convention on the Protection of Migrant Workers, if we are a signatory, if the country of destination of our migrant worker is a signatory to that convention, they should be able to receive any benefits that a national of that country can receive. So alam natin in other countries, available ang access to contraceptives, dapat meron din sila. Perhaps we can ask DOH to work with our DFA to at least have this information available para napapadali din naman. Kasi ang hirap nga naman, if you're new to a country, you don't even know where to begin. But let's say we would know for a fact that these are the list of countries that have signed this agreement. And sometimes, Your Honor, they are not signatories to the agreement, but they have very proactive health plans, even for migrant workers. At least paalam natin sa kanila, no? I think that's your concern.
Yes, thank you, Mr. President, Madam Chair, for those various concrete and helpful inputs. Sana nga po yung assurance na naibigay ng DOH tungkol dun sa continuation of family planning supplies and services, maitawid din sa POPCOM para POPCOM can also weigh in and work together with DOH to continue these services and supplies. And dun po salamat din po dun sa comments ni Madam Chair, Mr. President, on our women migrant workers. Minsan yung iba sa kanila ay nasa particularly difficult situation kung saan sa host country nila, they are not considered formal labor, no, at covered by the labor codes nung kanilang host countries tulad ng mga nationals nung bansang iyon. So I really welcome, Mr. President, yung sinabi ni Madam Chair na sana makapag-trabaho ang DOH together with, in addition to DFA, I would add, I hope that DOH can work with DMW to address the need for reproductive health services needs of our migrants. At na ang DOH will continue to work with civil society organizations and NGOs in expanding the reach of our sexual and reproductive health services, lalo na sa mga mahihirap na komunidad at sa sitwasyon nga po ng ating mga kababayan kapag nasa migrant work po sila. Salamat po, Mr.
Your Honor,
President, Madam Chair.
I would
Yes,
just like
Madam
to
Chair.
share with you the side conversation I was having, no? Kasi alam ko naman na same tayo ng concern dyan na yung sa POPCOM lang, hindi po kasi sila attached agency
Opo.
dito sa NEDA sila.
Opo.
Nagulat lang po ako kasi may statement na with the resumption of classes, baka tumaas ang teenage pregnancy. Sabi ko naman, yung pagpapasok ng mga bata, napakahalaga. Huwag natin sana ma-equate ng ganon kasi baka merong mga pamilyang maniwala sa ganon, hindi pa papasukin yung mga anak. So concerned lang ako dun sa ganong statement. I wanted to share that with her on.
Salamat, Mr. President, Madam Chair. Palagay ko magiging madali namang humingi ng palagay ko lamang po paliwanag mula sa POPCOM dahil in fairness din naman sa kanila, sila po yung unang nag-raise ng warning signal sa ating lahat na ang teenage pregnancy dito sa Pilipinas ay nagiging, ang tawag po nila doon, Mr. President, Madam Chair, parang national emergency na.
And I appreciate that, but I was also responding dito
Yes.
sa ganon na ingat lang tayo sa statements din na ganon. But I would like to believe that they mean well naman na siguro can phrase it a different way yung concerns. Kasi alam ko maraming magulang naman na gusto din naman mag-ingat ang mga bata at umiwas sa mga ganyan.
No po. And baka ang POPCOM, Mr. President, Madam Chair, sa ganyang concern, continuing concern naman po yun, going concern ay pwedeng makipagtrabaho din sa DepEd, pati sa comprehensive sexuality education at sa DSWD in terms of social protections kapag naging teenage parents pa rin. So salamat po para doon, Mr. President, Madam Chair. Dako po ako dun sa susunod na tanong tungkol sa well, Madam Chair, Mr. President, may mga grupo ng nurses ang lumapit sa aking opisina and some of them are still following up on the implementation of the Supreme Court ruling on the mandated base pay for nurses. Yung pong SG 15 para sa Nurse 1, kaugnay po ng RA 9173. May I inquire, Madam Chair, kung ano na po ang status ng implementasyon nito at kung nasama sa budget ng DOH ang para sa mga unang-una na pampublikong ospital under their watch.
Para maalala.
Opo.
Implement na yun.
Pero it's
Yeah.
sa lahat na ng facilities na.
Ito pa. Wait. Implemented as of these dates?
Yes,
As of-
it started
okay.
there and then sa lahat na ng facilities ng DOH we did that again.
Okay. Mr. President, the implementation of the nurse position from salary grade 11 to 15 has already been implemented nung 2021 pa. So if I may suggest, baka there are isolated cases. Baka Her Honor could get the case details and then we will give it to DOH for follow-up, no? Because generally, na-implement na ito.
Generally na-implement, Mr. President.
I mean, their knowledge is implemented na talaga.
Ah.
So baka nga may mga isolated cases.
At nasama na po ba, Mr. President?
Baka daw ho sa local government.
Sa national.
Actually, salamat, Mr. President, Madam Chair. Yun actually yung
Can-
follow-up question
Ang
ko.
monitor talaga nila is national. I'm sorry, Your Honor, hindi ko narinig.
It's alright, Madam Chair, Mr. President. Salamat para doon dahil yun po yung follow-up question ko tungkol
Sa
sa
local
LGUs. Yes, yes.
They're saying nga na possibly doon, but if Her Honor can give the details later on, pwede natin pa-follow up yan.
Salamat po, Madam President, Madam Chair. At nasama naman po ba sa budget ng DOH yung para sa mga pampublikong ospital under their watch sa usaping ito?
Yes, Your Honor.
Thank you. Thank you, Madam Chair. And yun na nga, ito nga po yung follow-up question ko, Madam President, na na-anticipate ni Madam Chair. Pwede po bang matanong sa DOH kung may mga initiatives mula sa end nila para siguruhin na yung mga LGU hospitals ay compliant din at yung mga nurse din sa private settings ay at least encourage na itakda yung minimum pay nila sa range po na ito.
It's part of the law. So it should be implemented by everybody.
Maybe work with the ILG to
Just help na lang.
Yeah,
Facilitate.
Yeah. Your Honor, since it's part of the law, clearly they expect that it is being implemented, but they will work closely with the ILG also to spread the information and the concerns that there are reports that it's not being fully implemented.
Salamat, Mr. President, Madam Chair. At para dun sa nurses in the private settings, meron din po bang initiatives ang DOH? At least mapeg dun sa yung minimum pay within that range.
Pero may balita.
Basta. Oh.
I remember that it's part. Okay. Okay. That's a burden.
Your Honor, the law only covers public hospitals. Now we know that. But when upon query with DOH, the concerns being raised by the private hospitals is that the cost of delivering health services will go up and it will be borne by the patients. This remains to be a concern that we should all we can't let go of because public and private healthcare is there's that strong balance, no, and partnership between the two, just like in education. So one of the proposals actually of DOH in managing our human health resource is to standardize the wages and benefits. But that is a subject and a topic for another lengthy discussion, Your Honor.
Certainly very lengthy, Mr. President, Madam Chair. But I appreciate na binanggit po yun ni Madam Chair at ng DOH. And I'm sure marami po tayong mga kasamang interesadong lumahok sa policy discussion na yan at sumuporta sa pamamagitan ng legislation. Madam Chair, lastly on this point, I also receive reports that some private hospitals are closing some of their wards due to a lack of attending nurses. So may push and pull talaga, di ba, yung cost, pero din yung availability of the health human resources. So hilingin ko lang po ang DOH na mag-look into sa ulat na ito and provide an update in writing.
Yes, and Your Honor, we have had lengthy discussion then on the management, the shortage of supply, not just now, but in the long term. So again, DOH is aware and we continue to work with them on that.
Salamat po, Mr. President, Madam Chair. Moving on po.
Oh, healthy kami. Tea naman, please.
Okay. The other day, Mr. President, Madam Chair, news sites reported the appointment of Dr. Eric Tayag as the new Undersecretary, and OIC Secretary Vergere was quoted as saying that there is still an ongoing discussion on where to assign him. That's almost the same line we heard when my Mista, retired General Yusek Picoy Cascolan, was appointed to the DOH. Tama po ba ako, Mr. President, Madam Chair, na ang DOH ay may 11 undersecretary, 2 sa kanila nasa OIC position? And kung tama po, pwede bang malaman yung rationale sa mga appointments vis-a-vis, say, yung attempt to right-size the bureaucracy?
Sorry, two of the assets are for
Sabi Sanchez.
yung mga total yan.
Picturean ko na wala. Picturean ko na wala. Tutuwa lang ako.
Gusto mo?
A minute suspension.
I just
Is it suspension?
more than half.
Session suspended.
Minority Leader. Because the answer is a bit complicated and it will take a lot of time. And while I was explaining, the Majority Leader was there asking us to hurry up. So with the kind permission of the Deputy Minority Leader, I think she has agreed that we just sit with the DOH later on to get a clearer answer on this.
Thank you, Madam President, Madam Chair. I can leave it at that for now, this matter of the DOH appointments. Just with this last remark for now that, Madam Chair, one of the health sector's pillars is strengthening health institutions and the workforce to ensure the agency's fitness to work towards universal health care. So inaasahan natin that appointments in the DOH are guided by some sense of thrust and direction. Hindi naman pwede na may ma-appoint, ang sistema ay mag-a-appoint, tapos bahala na mag-usap ang mga taga-DOH kung
Yes,
anong
Your
portfolio, opo, ang pwede nilang ipahawak sa bagong mga talaga sa
Yes, Your
posisyon.
Honor.
Out of respect both for the institution, the DOH, and the persons themselves,
Yes,
given
Your
their
Honor.
different fields of expertise.
We could not agree less.
Thank you so much, Madam President, Madam Chair, and I look forward to the continuation of this
Discussion.
conversation, opo,
Yes.
with the Chair and the DOH. And Madam President, Madam Chair, in response to the encouragement of the Majority Leader regarding the time, although just for the record, Madam Chair, I actually have 15 pages of questions. Then as I said at the beginning of my interpellation, I shortened them to just 13 baker's dozen questions. So halos humugot lang ako ng tig-isa sa bawat pahina. And I still have half a dozen questions left, but what I can do, Madam President, Madam Chair, is just to ask 2 last questions and then i-manifest ko na lang for the record yung subject nung huling 4 na tanong and just request DOH for the answers in writing. So I hope that will be helpful also to our Majority Leader. So to my second to the last question, Madam President, Madam Chair, on the PNAC, the Philippine National AIDS Council.
Come on, homemade.
So my next set of questions is about our HIV/AIDS policies and programs, and most of the questions are addressed to the PNAC. In a recent article, news article, the DOH cited an increase of 37% in HIV cases in September compared to the recorded cases last year during the same month. Mari po bang itanong sa DOH PNAC, ano pong nagda-drive, anong drivers nitong increases, at on track pa rin ba tayo sa ating 95-95-95 targets? Ano po yung current and then planned strategies ng DOH para mag-get on track muli at makamit yung mga targets natin?
Percent patients, the viral load went down.
Yes, ma'am. Yes, it's percentage. 63, 65. So this is the goal. Yes. This is the actual. The goal is 95, 95. Okay. So, ito na lang. Simple. Ito yung tanong, bakit daw a year ago, mas mataas to ngayon? Mas mataas yung cases ngayon. Oo. Yung detection. Baka detection pa. Mas numbers.
That's not easy. That's not the only indicator.
What you're worried about.
And then, yes.
The past. Yes. And we are dealing with things that we expanded after sites where we sure. Sites that we teach.
Madam President, meron ba? The observation of Her Honor is correct that the cases have been increasing. So the civil society and the professionals no involved in HIV prevention and management are correctly alarmed and concerned. So on that note, they are addressing this by increasing the tama ba yun? Increasing the access sites, no? So the places where people can go, the hubs itself, and then also, particularly during the pandemic, they were already delivering house to house, do you call the maintenance? The medication, the ARVs, Your Honor.
Salamat, Madam President, Madam Chair. Pero ano din yung naging drivers nitong increase na ito? At on track pa ba tayo sa 95, 95, 95?
The lockdown, Your Honor, is clearly a major contributor to the situation we are faced with right now, Your Honor.
At on target pa po ba tayo? On track rather, dun sa targets na 95, 95, 95?
We are currently at 63, 65, 97. So,
Let's stay lang. In the previous. Nag-improve naman. Opo, konti. Nag-beat siya na naging 61.
then nag-pick up. Okay. Well, the worst is over in a way, Your Honor, kasi yung targets na yan nag-dip nung 2021. Then naging 61% na. Then naka-recover ng konti, we're up a little bit to 65.
Salamat, Madam President, Madam Chair. I wish I could concur that the worst is over. Pero
Yes, I
well,
wish too.
mabuting yes, Madam
That's
Chair.
just my choice of words. It might not be the right words. I'm just saying in terms of the targets, let me rephrase that. It was worse in 2021.
Thank you, Madam President, Madam Chair. For sure, the 97 of the third target, it's good, but even better kung pwede nating i-up. Kasi sinasabing natin 97% nung enrolled in treatment virally suppressed. Pero i-up pa po natin, palapit dun sa 95, yung currently 63% lang ng diagnosed who are in yung unang sting diagnosed or nag-test. Sorry. I-up natin yung 63% na who know their HIV status through testing at i-up din natin yung 65% lang na enrolled na sa ARTs para lumaki yung absolute number represented by that single healthy percentage right now of 97% na virally suppressed. Salamat, Madam President, Madam Chair. Madam Chair, I noticed that the Philippine National AIDS Council did not receive additional funding. Ano po yung status ng funding allotted para sa PNAC? At pwede po bang i-confirm ng Chair na walang funding allocated para sa trabaho ng Council? Allocated lang para sa Secretariat?
Secretariat lang. Ito yung current budget. Philippine National AIDS Council. 43.0%
nila. 68. Spend for commodities. Okay.
Tama na, alam ko yan. Oo. Yeah. Madam President, I remember this because we studied their requests, and a lot of the requests can be handled by DOH. Like the commodities are with DOH. They had actually some requests like janitorial services, things like that, na either they were either very small in number, or it's something that all of them we discussed with DOH. Baka pwedeng magkatulungan na muna, no, because of the limited fiscal space. But rest assured that the most important components there, which is the commodities, have been funded.
Salamat, Madam President, Madam Chair. Pero yung commodities funded under PNAC o under DOH?
DOH yan.
Under
So it's
DOH
not
po.
reflected in their budget.
I see. So ang status of funding allotted for PNAC ay zero or?
Oh, no, of course
Mayroon.
not. They have
Apo.
43 million, Your Honor.
Okay po. Pero ito po bang funding ay allocated hindi sa trabaho ng council, kundi para sa secretariat lang?
Yes, for the secretary. PS. Services. Secretary.
Yes, the funding for the secretariat is intact.
Yun po yung 43 million, Madam President.
Under the NEP, Your Honor, it's 37.6 million for PS and then 6.25 for MOOE for a total of 43.9 million.
Salamat, Madam President. So, the vast majority or the large percentage of the item of the funding allotted for PNAC ay para sa PS. So, kasama na yung secretariat. Tapos 6.25 million lamang out of 43 million. So, parang 15% lang para sa MOOE or the work of the council itself.
Senior citizen.
It would be ideal, Your Honor, if there was fiscal space for more to fund some activities of the council. But for now, what was allocated is funding for the secretariat.
Salamat, Madam President, Madam Chair. And as a follow-up question, are the PNAC itself, the council, and the secretariat fully constituted? Sino po sa DOH ang umuupo bilang chair ng council? At sino rin po yung executive director ngayon ng PNAC? At
Sorry,
gaano ka-
can Her Honor repeat the
Sorry,
question?
yes, Madam Chair. Yung PNAC ba na council at yung secretariat fully constituted na? Sino po sa DOH ang umuupo bilang chair ng council?
Yes.
Sino ang current executive director ng PNAC? At ganong katagal na siyang nagsiserve bilang secretariat ng council?
Sino siya?
Director Malu Oresca.
Director Malu Aresca is the head of the secretariat.
Salamat, Madam President. At sino pong umuupong chair ng council para sa DOH?
The chair is the Secretary of Health. Yeah. Your Honor, to be clear lang kasi I promise our Chairman of Finance that I will always be meticulous with the funding requests. Yung mga request naman na sinubmit ng PNAC is insurance, office rental. That's it. Wala naman akong nakitang request for activities of the council kasi I in as much as hindi naman din mapopondohan lahat, we really try to support what we feel is the most vital for the proper implementation of the law, Your Honor. So walang ganun. I would be happy to show you na lang the list of the requests. So yun, Your Honor.
I can believe it, Madam President, Madam Chair, sight unseen. Dahil in fact, katunayan po, Madam Chair, it seems that the proposed budget of PNAC does not reflect the proposed budget of the council that its finance committee prepared. Hindi po isinumite. Kaya I can actually share, Madam Chair, the frustration that I seem to be feeling, Madam President, the frustration I seem to be feeling from the Madam Chair na parang hindi according sa law yung budget ng PNAC. Heavy sa PS, sobrang kapos na kapos sa MOOE. Heavy sa secretariat, kapos na kapos para sa aktual na trabaho ng council, para sa mga PLHIVs and people living with AIDS itself. And I'm inquiring, Madam Chair, because recurring po actually ang mga sumbong at reklamo sa akin ng maraming advocates about the alleged indifference of the current executive director sa trabaho ng council. For the record po, yung mga reklamong nakarating sa aming opisina range from, well, trivial hanggang sa mas seryosong usapin na inaatasan di umano ng kasalukuyang executive director na wag tugunan ang mga request for assistance ng mga komite ng PINAC. Katunayan, Madam Chair, yun na nga po, yung proposed budget na binuo ng Finance Committee ng Council, hindi actually yun ang isinumite. At ang mas malalang reklamo na narinig namin, allegedly, the executive director did not heed the call of the chairperson of PINAC for a meeting, when supposedly the ED of PINAC shall be under the direct supervision of the chair of the council. Ito pa, Madam Chair, kahit ang opisina ko humingi ng pulong sa PINAC Secretariat since last year, hindi rin po nabigyang pansin. And even during my last briefing in October this year with DOH, with OIC USEC, Beverly Ho, Director Frances, and all the rest of the bureau directors, noticeable po ang either absence o kung nandun man sila, silence ng PINAC Executive Director. For someone po, Madam Chair, Madam President, in charge of a council requiring collaboration, coordination, and co-responsibility with the PLHIVs and their communities, it's bothersome if these allegations are true. Lastly, about this topic, Madam Chair, I'd just like to briefly read just 6 bullet points from an incident report. Over the phone, Ms. Malu Oresca with the complainant of this incident report. Sabi po nung complainant, I asked politely, ma'am, meaning the ED, kailangan ko po ng suporta ng PINAC Secretariat dahil World AIDS Day na po. And she immediately raised her voice and said, Panginoon namin kayo, ano gusto mo? Itigil ko ang training ko? Lahat pinakikialaman ninyo. Pati pagpapalit ng focals, pinakikialaman ninyo. Bakit? I said in a low tone voice, ma'am, hindi naman po. Kailangan lang po ng suporta ng IEC po. She still raised her voice and said, Panginoon namin kayo, ako boss dito. I respectfully told her, ma'am, kailangan lang po ng suporta at nag-volunteer lang po ako at nag-agree po ang lahat ng members ng IEC na ako ang gawing focal ng World AIDS Day Core Team para sa PINAC-led event natin po. At ako po ang inassign na makipag-coordinate sa PINAC Secretariat focal po. And I politely continued, ma'am, baka hindi ko kayanin ito mag-isa kung walang tutulong po sa inyo. She replied back, masyado kang negative. Ako transparent akong tao. Ikaw, di mo pa sinusubukan, sumusuko ka na. Kayanin mo yan. Asan ang committee mo? Kayanin nyo. I continued to ask for support. I told her in a calm voice that, ma'am, bino-volunteer ko lang ang time and effort ko sa PINAC-led activity at marami pa po akong tasks sa organization ko po. She raised her voice again and said, bakit? Yan lang ba trabaho namin? Madami pa kaming trabaho. Tingin nyo mga Panginoon namin kayo? I was still politely asking for support and she then became personal. Out of the blue, she said in her loud voice, alalay kanyang tech rep na yan. Tech rep lang siya. Ako, director. I said calmly to de-escalate the situation. Ma'am, wag po tayong personal. Humihingi lang po ako ng tulong. She continued her accusation. Hindi. Alalay ka niya. Akala mo ba di nakararating ang balita sa akin? In my low tone voice, ma'am, ginagawa ko lang po trabaho ko para sa committee. I continued to be calm and continued to ask, almost begging for support. And I told her that the new PINAC Secretariat's focal for IEC said that he can offer his time only during lunch break while they were on training. She came back to me and screamed again, Panginoon namin kayo, mga, obscenity in parenthesis, kayong mga committees kayo, kung makapag-utos kayo, kala nyo mga Panginoon namin kayo. I said, ma'am, hindi po ako nag-uutos. Huwag nyo pong isama ibang committees. Sa IEC committee, kailangan po namin ng suporta ninyo. I was still politely asking and even desperately begging for help. Then she screamed, calling the person's name from the other side of their office at the top of her voice. I heard that the person came and then she screamed at the person and asked, ano hinihinging tulong ni the complainant? And the person answered, "Ma'am, kailangan po ng tulong ng IEC committee para mag-follow up sa mga video messages ng PINAC Council members na ipopost para World AIDS Day." She asked in her loud voice, "Bakit?" The person answered, "Ma'am, kasi po World AIDS Day na." She asked, "Sino ba ifa-follow up mo?" The person said, "The PINAC's GAs." She asked, "Ilan ba yan?" Then the person mentioned the number. She continued asking, "Kailan ba kailangan yan?" And the person said, "Next week po, December 1 ang World AIDS Day po natin." She said, "Matagal pa yan." In her loud voice, she asked the person, "Bakit hindi mo finalo up dati pa?" The person said, "Ma'am, kakalipat nyo pa lang sa akin last week para maging focal ng IEC." She asked what were the videos for. The person said, "Ma'am, kailangan po kasing i-post sa PINAC Facebook page next week po." She said, "Why do they have to do that?" The person said, "Tayo po admin." She asked the person why he said he can offer only lunchtime to me, and the person said, "Ma'am, sabi nyo, full focus lang po kami sa training nyo." The line was cut off. So Madam Chair, talagang kailangan itanong, ano po ang PINAC Council Chair at Secretariat Executive Director's responses sa mga aligasyong ganito?
Madam Chair, it's unfortunate that the head of the secretariat is not present because she's in the hospital as we speak. So I actually would have wanted to ask if you could defer, pero pinabayaan ko na lang kasi wala siya ho dito to explain eh. But the chairman is here and she commits that they will look into it. In fact, on Wednesday, they have convened a meeting and she will personally, she will ensure that these are looked into, Your Honor.
Maraming salamat, Madam President, Madam Chair, and to the Secretary for this commitment. I hope na makatanggap po ng update dito para rin maparating sa mga PLHIVs na sobrang disturbed na sa ganitong sinasabi nilang mga insidente. And after all, Madam Chair, whether there is truth to these allegations or none at all, the findings of the evaluation report on the 6th AIDS Medium-Term Plan, AMTP6, tell us the kind of leadership and management we have or don't have in PINAC, the lack of costed operational plans and mechanisms for planning, implementation, and monitoring of the AMTP6, the weakness of national and local coordination of HIV/AIDS planned responses, limited commitment of government agencies to provide counterpart funds for PINAC plans and operations, and the incapacity of the PINAC Secretariat to provide staff work and to support the PINAC functions. Madam Chair, how will these concerns be addressed as we formulate the AMTP 7? Yun po ay concern dapat ng buong PINAC Council at Secretariat kasama ang ED. I hope in closing on this topic, Madam Chair, the PINAC Secretariat and the Council will be reminded of and faithful to its mandate. RA 11166 provides a policy and legal framework in our collective response to HIV/AIDS. Karapatan ng PLHIV communities na magkaroon ng mas sensitive at mas responsive na institution. Nakakahiya naman na ang mga CSOs at development partners ng gobyerno ang mas kumakarga pa sa mandato ng PINAC kaysa sa secretariat mismo. I hope that the committee would consider providing, in spite of all this, sa kabila ng lahat ng ito, Madam President, Madam Chair, I hope that the committee would consider providing additional budget for the Council's operation, but not only to the secretariat, and urge member government agencies of the Council to provide funding support as well. Salamat po, Madam President, Madam Chair, and I'll just ask my last question.
Okay, thank you, Your Honor. I was just getting some feedback from the secretary and the chairman of PINAC. Obviously, we all want PINAC to be effective. Tagal na
Actually po, na-inherit ninyo yung bill na yan sa akin because my term ended and hindi natapos yung batas na, hindi siya naging batas na punta sa inyo. So rest assured that I also want to see the success of the bill. And the secretary is very proactive about, ensuring that the mandate of our laws are followed. And of course, we care very much for the community.
Maraming salamat, Madam President and Madam Chair. So to my last set of questions there about the Food and Drugs Administration. So my office received complaints alleging that the FDA is giving an undue advantage to foreign manufacturers and distributors of household urban hazardous substances and pet care products, whether intentional or unintentional. Ang nirereklamo ng ating mga local MSMEs ay pinahihirapan o nahihirapan silang makakuha ng Certificate of Products Registration, CPR, mula sa FDA. Kulang din daw ang institutional support to our local MSMEs to ensure ease of doing business and access to publicly funded product testing facilities. So for the record, Madam President, Madam Chair, ano po yung standard set and used by the FDA sa pag-grant ng Certificate of Product Registration para sa household urban hazardous substances at pet care products, particularly iyong proseso ng product testing?
Madam President, would it be okay if I give a copy of this to our colleague because it's a visual, no? So it may be easier to understand the process if I show it to her.
Thank you, Madam President, Madam Chair.
The majority floor leader
Oh
to
my God.
deliver.
And I'll ask any follow-up questions in writing together with my last questions in writing.
Perhaps we will instruct the FDA DG to explain that in writing. It's a good visual, but explain it in writing. And if you have any ideas on simplifying, but of course, always maintaining the standard, no? Okay.
Salamat.
Okay daw po.
Salamat, Madam President, Madam Chair, at sa FDA leadership. As a follow-up, Madam Chair, baka nandito na rin sa diagram, may kompleto bang product testing facilities ang gobyerno to cater to the needs of local MSMEs? O kaya ay may existing bang institutional partnership sa ibang ahensya, pribado man o publiko, to help local MSMEs with their product testing needs?
UST para sa NSM, yung laboratory nila at yung
Tie up na with UST.
This is all for the day.
Never ako.
UST.
Co-president.
oh, for MSM, the Department of Science and Technology Laboratory.
But sometimes the actual registration still goes through FDA.
Yes, yes, so it's just the lab.
Actually, it's with you. It's your,
Yes.
it's a tie up with you.
For MSMEs, the DOST has the testing lab. So FDA works with DOST.
Salamat, Madam President, Madam Chair. Actually, na-anticipate na ni Madam Chair yung huling tanong at huling brief manifestation ko by mentioning DOST. Opo, kasi in the absence
Senator
po of...
Tolentino wants to take the floor.
Oh, Madam President, because, Madam President, Madam Chair, in the absence of government-funded or supported product testing facilities, or in the lack, kung DOST sa ngayon ang may testing lab, lumalabas po na halos walang choice ang ating local MSMEs na magpunta sa pribadong product testing facilities, gumastos ng mahal at maghintay ng matagal habang patuloy ang paglabas ng kanilang kapital baka ang ending, yung local MSMEs ay lugi na, abonado pa. Opo. And for my very last question for today, Madam President, Madam Chair, ang isa rin pong ipinararating sa aking opisina ay hindi daw kinikilala ng FDA ang resulta ng mga product testing na isinasagawa sa DOST facilities. So pero teka, kanina pinag-usapan lamang po natin, Madam President, na may DOST testing lab. Totoo po ba na hindi kinikilala ng FDA ang resulta sa
Oh.
DOST testing lab? At kung totoo, bakit? Di po ba dapat, dito babalikan ko yung punto ni Madam Chair, di ba dapat mag-harmonize na lang po ng policies ang FDA at DOST, policies, operational guidelines, at standards kaugnay ng product testing?
Oo. Antayin na natin yung sagot kasi gusto ko din ito malaman eh. For the record, I was a practitioner I was an FDA practitioner in my first few years as a lawyer. So I'm always very curious on what the problems are, the solutions are. So, yung tanong was, hindi niyo ba kinikilala? Ang alam ng Director General is they recognize the findings of DOST, but sinisigurado niya ngayon dun sa team niya.
Salamat, Madam President, Madam Chair. Kung ma-confirm nga ng FDA leadership na kinikilala nila ang mga resulta ng DOST testing lab sa ating mga local MEs, mabuting-mabuti
Ba
po
sa
iyon.
inyo? I'm sorry if I
Yes, ma'am.
missed that. May sumbong sa inyo na hindi daw kinikilala. Meron ho bang ganon?
Ganun po, isa po yun sa ipinararating, hindi daw kinikilala ng
okay.
FDA.
Would the DG know if itong DOST testing labs are just in the main office, which is in Taguig, or may iba pa ba silang centers in other parts of the country?
According to my director, wrong test po yung nasubmit instead of virus protection. Ang test was for bacteria.
So the wrong test was made.
Yun lang.
So in a particular case, there was a wrong test conducted. So baka pwedeng ma-improve lang yung communication nyo kasi baka naman, I don't know if how much leeway they have, no, in determining what test is required. So I think that the instructions have to come from you. What kind of test?
It's an isolated case.
Oh, ang alam daw ni DG, there's an isolated case on that.
Salamat,
That issue.
Madam President, Madam Chair, and I do hope that the DG is right. But in any case, Madam Chair, I strongly encourage the FDA and DOST to harmonize
Of course.
opo, and
We
coordinate
support.
opo, their policies, salamat po, operational guidelines and standards regarding product testing. At the very least, may common understanding dapat ang FDA at DOST sa product standards at conformity doon. Obligasyon natin bilang ahensya ng gobyerno na balansehin ang pangangailangan para sa consumer protections at pagsuporta sa development and promotion ng ating mga local MSMEs. So, just for the record na lang, Madam President, Madam Chair, ang isusumite ko sa DOH through the chair na mga huling tanong ay tungkol sa universal healthcare, mga tanong po tungkol sa UHC integration sites, tungkol sa local health boards at special health fund, tungkol po sa matching grants, at tungkol sa health regulations. At hihintayin ko na lang po yung mga sagot ng DOH in writing. Maraming salamat po,
Thank
Madam
you.
Chair, sa DOH family led by Sec. Vergere at Madam President.
Your Honor, just to clarify, you're submitting specific questions on that, or those are the general questions that you want
I
them
have
to?
specific questions.
And you will submit.
Opo.
You will ask them to respond to it.
Opo,
You will
in
give us a
writing.
copy. Okay,
Salamat.
thank you very much po.
Salamat.
Madam
Majority
Chair?
Floor,
Thank you. We thank the Senate Minority Leader, Senator